Hi, I'm Dave Ertl, disability lawyer at Ertl Lawyers. One of the most common questions we get is, do I qualify for long-term disability benefits if I have rheumatoid arthritis? Rheumatoid arthritis, also known as RA, is a major cause of disability, and it can qualify for long-term disability benefits. RA is considered an autoimmune disease, meaning the patient's immune system is attacking healthy tissues in the body by mistake. With RA, the immune system attacks the membrane of the joint, causing it to thicken. Consequently, the ligaments and tendons that hold the joint together become weakened and stretched. The joint loses its shape and alignment and can result in deformity, dysfunction, and loss of use. RA usually affects the small joints first. As it progresses, the disease can affect larger joints. Now, while it mainly affects the body's joints, RA is considered a systemic disease, meaning it can affect many parts of the body, including tissues and organs such as eyes, skin, heart, the nervous system, and the lungs. There's no cure for RA. The goal of treatment, which is namely medication, is to reduce the inflammation and drive the disease into remission to slow its progression. The most common symptoms of RA include joint pain and stiffness, swollen joints, as well as crippling fatigue. Those symptoms can make it impossible to do your job, much less day-to-day activities. If RA is untreated or it's not responsive to therapy, then the inflammation and joint destruction will lead to loss of physical function, inability to carry out daily tasks of living, and difficulties in maintaining employment. Did you know that people suffering from RA are 8 times more likely to face functional disability compared to adults in the general population? And on average, the chronic RA patient has 2 or more chronic medical conditions. The most common include cardiovascular disorders, gastrointestinal, renal, and pulmonary diseases, infections, osteoporosis, tumors, and depression. Now, this is significant because of the combined effects on the quality of life, functional ability, prognosis, and outcome. Also, early retirement because of RA is frequent, with up to 50% of those living with RA forced to leave the workplace within 10 years of disease onset. Insurance companies frequently deny LTD benefits for people with arthritis. Some of the most common reasons include, number 1, your condition is considered a pre-existing condition and the coverage is excluded by the pre-existing condition clause of your disability policy. 2, because you've had arthritis for years and you've been working with your disability for years, there's no real change in your disability and you should be able to manage it. 3, because arthritis symptoms and the severity of symptoms are often categorized by periods of flare-ups and remissions, your condition is only temporary and there's no reason you can't work. But there are many other reasons that insurance companies rely on to deny you LTD benefits. Has your claim for disability benefits been denied? Were you receiving benefits and the insurance company terminated those benefits? At Ertl Lawyers, we'll work with you and your doctor to help challenge the insurance company's decision to deny you. Where necessary, we'll engage other trusted professionals to support your case, including functional capacity evaluators and vocational evaluators, to help credibly explain why your disability symptoms are preventing you from doing your own occupation or any occupation. At Ertl Lawyers, we offer a free case assessment and fair, flexible rates, including contingency fees, meaning you don't pay unless you win. If you're looking for long-term disability lawyers that care about your well-being, you've found us. Call us today. Our help can make all the difference.